Historically, therapists thought that giving the anorexic more control would be helpful. This is no longer accepted. It may be natural to assume that your child is being difficult and making completely voluntary choices to not eat. Realize the dark clouds of anorexia are converging in on your child's brain, combined with medical factors caused by starvation that become a mental tsunami that the child cannot adequately escape from on his or her own. The sooner one deals directly with it, the better. But dealing with it does not mean taking blame for it. Although it's very easy for parents to question themselves when a child develops anorexia and to wonder what they did wrong, realize that you did not cause the eating disorder. This is a brain disorder.
Families don't cause eating disorders, in my opinion. Don't put a lot of energy into feeling guilty and trying to figure out what did we do wrong. I think you're better served by putting the energy into how do we best understand this, right? And how do we best move forward to help our daughter.
The old school of thought that parents and family dynamics caused anorexia has been reversed to understanding that you, the parents, are usually your child's best resource in combating anorexia. In fact, the most successful therapy is based on parents helping their child. It's called family-based treatment, or FBT for short. A joint study from the University of Chicago and Stanford in 2010 concluded that FBT is more than twice as effective in producing recovery from anorexia as individual therapy, with a quarter of the incidence of relapse.
Daniel LaGrange from the University of Chicago explained, what this study unequivocally demonstrates is if you have an adolescent with anorexia nervosa who is medically stable, family-based treatment should be the first line of treatment.
In FBT, hospitalization is utilized only until medical danger is past.
When we are facing the situation as a family or as a professional of a child that has anorexia nervosa, I think we need to first and foremost think about family-based treatment. And it's a treatment model that has developed and is now available just about worldwide, in which in 3 phases, the family works with the child and assumes responsibility for the refeeding process. Then in the second phase, there is a transition to the child taking more responsibility for the refeeding process and the maintenance of appropriate nutrition. And in the third phase, the child, with the support of the family, moves on to really take on more appropriate developmental progress. The emphasis and the importance that getting the brain back on track nutritionally takes precedence, right? But once we get through that phase, the rest really becomes about empowerment and collaboration.
Let's define some of FBT's terms. Refeeding means increasing daily caloric intake so that the child returns to a healthy weight. Caloric intake and weight goals should be discussed with a professional. Normally, calories are increased every other day to a point where there will be a consistent weight gain. If weight plateaus, calories are increased. Refeeding usually requires you, the parent, to decide what your child will eat and to support him or her to eat it. The parent puts the food on the plate. This is called plating. Places the food in front of the child and sits by him or her supportively while the child eats everything on the plate. Often, phase 1 also includes denying or strictly limiting your child's exercise.
We had to tell her, you cannot dance. We took it away for 6 months and said, you cannot dance until you reach your goal weight.
When she exercised, she felt better and she was happier. So you're feeling like you really are taking the one part of her life that is happy and makes her feel better. And it's like, how can I possibly take this away from her?
Yeah.
Yet in hindsight, she and every other recovered anorexic I've talked with all have said that exercise was absolutely part of their eating disorder. Until they gave that up, they couldn't get over their eating disorder. Refeeding is like having to live a life you have been taught against and having to force a child to do what is incredibly hard and take away from the child what the child loves. So you're constantly just feeling like you're the bad guy. But you realize this is what my child needs.
Many parents wonder why refeed instead of just insist that their child eat enough food on their own. The answer is threefold. First, refeeding is compassionate. Second, refeeding is usually necessary. And third, refeeding is efficient.
I realized how much stress it was choosing what to eat for my daughter. I was coming home from Europe. We were on a plane, and she'd only eaten one salad. And we had a stopover in Chicago, and I told her she had to eat something when we got to Chicago. When we got there, we were looking for a Subway. She wanted whole wheat. We couldn't find a Subway. We went through maybe 30 different restaurants, trying to find one that had the acceptable bread for her. We couldn't find one. She refused to eat anything that didn't fit her specific requirements. I was frustrated. She hadn't eaten. I was scared. I was angry. And I demanded that she eat something before we get on the plane. She looked at me and she said, "I hate you. I will never forgive you for forcing me to do that." But I held firm. I said, "You are going to eat something before we get on that plane." She couldn't do it. Finally, she turned to me and she said, "Dad, you pick something and I will eat it."
Every aspect of eating, including what to eat, is intensely stressful for an anorexic. Having parents choose and plate food independent of their anorexic child input can actually take away the stress from the child. Some compare anorexia to cancer and refeeding to chemotherapy. If your child had cancer and needed chemotherapy, yet feared the pain and suffering and consequences of chemo, you would nonetheless compassionately support him or her through the process. Think of eating as your child's chemotherapy or medicine for anorexia.
With our daughter, we gave goals for calorie intake, and she would fight them. We plated the food, we set it in front of her. She would fight us, but we would say, "This is your medicine, and you need to take it." She would continue to fight, but we remained with her and calmly supported her in what needed to happen. And at a certain point, she seemed relieved that we were there to give her the support and also the instruction.
Your child's brain and every body organ is being affected by malnutrition. Your child is very unlikely to be able to refeed without your help. Sufficient calorie intake and weight is necessary for a healthy body and brain.
Right now, your child's brain patterns are destructive. They've gone down the same restrictive neural pathway so many times that restriction has become the default. Something like, when stressed, restrict what I eat. Eating is stressful, restrict even more.
Your refeeding helps your child override the destructive anorexic neural pathways that have been built up over time.
It's the idea that you want to pull that brain out of the, sort of the wrong marinade to bring it back on track into a more, normal developmental circumstance.
Because of his or her restriction, your child's metabolism has slowed down. It's gone into survival mode, somewhat like a bear in hibernation. As the bear comes out of hibernation, it needs a lot of food to move its body from a slowed metabolism to a normal one. Similarly, your child will eventually need more calories than what most people his or her age and size need, sometimes nearly double what a peer may eat. Because of Ed's dictatorial power over your child, your choosing foods and calorie intake will help your child recover much more efficiently and quickly. Although most parents choose to plate their children, parents working with professionals may individually tailor refeeding to their child's needs and family circumstances. Refeeding and not allowing your child to exercise can seem brutal. It may seem to all of you that you are taking over your child's life. Remember, your child is ill, and the illness has made it that he or she cannot choose wisely about what to eat and how much to exercise.
It may seem strange that a child will explode over a mouthful of food that she has to finish. You have to be the referee. When the referee at a game sees all of the fans exploding and yelling and doing whatever they want to do that can be very disruptive, that referee knows the rules and has to maintain his calm, has to make sure that the game continues according to the rules. That's who you are.
Anorexia and chaos reinforce each other. Ed creates chaos and thrives in overreactions and heightened emotions. Ed threatens and blames, isolates and induces fear. Ed has the advantage in emotionally chaotic situations because parents become emotionally charged themselves, naturally, limiting their ability to focus, plan, strategize, think logically, and stick to the rules. When you start refeeding, realize that Ed will fight you tooth and nail. Stay calm. Stick to the rules. There are 3 powerful techniques to help you avoid an emotional hijack. They are, first, label your own emotions as they arise. The simple act of labeling your emotion helps you remain more rational. When your emotions start to escalate, consciously breathe deeply and focus on your breath. Deep, focused breathing diffuses cortisol. Third, think of your child as separate from their anorexia.
This is not easy. I blew up several times.
When we could tell that our daughter was becoming rigid and refusing to eat, freezing up, we would try to state objectively what we were seeing.
I see you playing with your food, cutting up into tiny pieces, and I see your head is down.
Then we would explain what we guessed was going on.
I guess that anxiety is really high right now. Can you tell me if I'm close?
We would then ask how she would describe her feelings.
Can you give me a name for what you're feeling right now?
I'm so mad at you. I hate this food and I hate you. You're treating me like a baby.
Finally, we would acknowledge her feelings, acknowledge that it's hard, and gently remind her that she has to finish the food on her plate.
I know this is hard, but we have to stick to the rules.
This is where parental persistence becomes so important. Stay calm, don't give in. Most children will eventually finish the food on their plate. You can attempt to even the playing field between Ed and your child by engaging the rational part of your child's brain before, during, and after mealtimes.
My daughter reported that playing spelling, word games, or math games at the dinner table really helped her to be less anxious about eating. You can play calming music, plan a family vacation, write thank you notes, share good things that happened that day, do deep breathing as a family, watch funny YouTube videos, tell jokes, memorize quotes or poems.
Now let's move on to phase 2 of FBT, which is the transition between intensive parental oversight in regards to eating and exercising to eventual independence in phase 3. During this transition time, your child is given more and more freedom to dish up his or her own plate and to start to moderately exercise. As he or she demonstrates the ability to remain healthy, you are able to back off the monitoring more and more. Although you do remain vigilant and supportive, you can relax a little more and back off. Phase 3 does not begin until your child has reached at least 95% of his or her target weight and has demonstrated the ability to wisely self-regulate food intake and exercise. There is no definite boundary between phases. Relapse is common, and going back and forth between phases is typical. You return responsibility for eating and exercising to your child. Weight continues to be monitored. It is at this stage that traditional therapy can be utilized to address other mental illnesses because the brain has recovered sufficiently to learn and apply therapeutic skills. FBT will not work for every child. There are other options. If FBT does not work for your family for whatever reason, don't give up. Regardless of what therapy you use, nutritional rehabilitation should be a vital beginning.